welcome all of you to Wellness 2023 program on depression and anxiety in older adults. And we're really delighted to have our guest speaker here, Nicolette Castagna, who's part of the geriatrics department of the FSU College of Medicine, and we're familiar with that. I apologize for the small print. This is Live and Learn. I had no idea what size font was needed for this, so but I want to just mention that this is the program, and that our guest speaker, of course, will be first, and she will be followed by Don Chenault, and you can stand now, and later you can just come up. And as you know, he directs, is a coordinator of our fitness program and is dedicated to our health and well-being. And Peggy Shea, who is retired as a professor in nutritional science from FSU, and I'm sure will be equally informative. And interestingly enough, mental health has come a long way since you and I were born. Think back to what it meant when we were young to say that somebody was mentally ill. There were probably two choices. They either went to an insane asylum or they had psychoanalysis on a couch for 3 years. And there was very little in the whole mental health field. And we've learned so much since we were young about the brain and how the brain works, and the chemicals and the nutrition and exercise. So one of the goals of Wellness 2023 is not only to learn more about diseases, but to learn more about how you and I can do something in our own lifestyle. We have choices to make that can either make it harder. We may not be able to cure the disease, but we may be able to postpone the progress. We may have a longer active lifestyle. So this is part of the purpose of each of our programs. So one of the things we want to do in each case is to interview somebody. Well, we may have come a long way, but I couldn't find many people who have depression who wanted to be interviewed, so I am the guinea pig. And if you don't want to hear me every other time, I would love it if some of you would come forward and say, you know, I have been dealing with such and such an illness, and I would love to talk to people about how I manage my illness and how lifestyle choices have affected the course of my own illness. So with that, let me say more now about our guest speaker. Not only is she part of the health sciences department of geriatrics, she is a licensed mental health counselor, a certified dementia practitioner, and she has a background in public health and aging. She has a master's in clinical mental health college and mental health counseling from Wake Forest University, and a master's of public health from our own Florida State. She's part of the College of Medicine, as I said, and she works with them on a special project, and she'll have to tell you what the initials mean, but HRSA project funded Geriatrics Workforce Enhancement Partnership Leadership Team. And she's been with that team since 2015. She works as a counselor at the Senior Center, and she's supporting older adults who deal with loneliness, social isolation, and depression. Her work centers around age-friendly healthcare and communities, dementia sensitivity trainings, family caregiver support, and strengthening collaborations between aging network sectors to promote system improvements and synergies. Thank you, and welcome our guest speaker, Nicolette Castagna.
Hi, everyone. Can you hear me okay? Great. Thank you for that. Sorry the introduction's so long. So I am so happy to be back at Westminster Oaks. I actually really started my career here. I worked in activities at the Perry Center and Health Center in, what year was that? About 15 years ago. And have periodically been back here through the partnership with the College of Medicine and the Senior Center and just different initiatives that this great organization is involved in. So I'm so happy to be back. Look at this turnout. It's really fabulous. This is a bit of a tough subject, but I think just by the sheer number of people in here, it really shows how universal the issue of mental health challenges are and just how much people want to learn to support themselves and to support others. So it's really powerful how many of you all are here. So thank yourselves for showing up. No pressure for me, right? So we'll see. I would love for this to be interactive. I have just a little bit of time and a lot of information to cover. So I might ask that we hold questions to the end. But I'm going to be talking about depression and anxiety in older adults. So really those two terms are kind of generic terms for depression. Maybe it's interchangeable with feeling sad. Anxiety, maybe someone says I'm feeling anxious if they're feeling worried. But I'm going to really explain more of the clinical or, when those conditions or states of being get to a point where they're more classified as an actual treatable illness. So that's what I'm going to cover in my talk. The first thing I want to ask is, please, if you could, if you're feeling brave, raise your hand if you or someone you love has experienced depression or anxiety. Okay, I'm seeing some really quickly raised hands, some kind of lower raised hands. And just think about, what if I was asking, if you or someone you know is afraid of falling or has experienced a fall or has a chronic disease, maybe everyone's hands might have gone up a little quicker and it might have been an easier thing to point attention to or to participate in. So just want to kind of point out that there is some stigma, there is some shame, there is a little bit of embarrassment that's sometimes centered around mental health issues. But again, thank you all for being here, and it is a really common condition, especially after the pandemic that we've all experienced. I'm going to talk about some numbers, some data across the country and world in a minute. But I also want you to raise your hand if you're worried about in the future developing one of these conditions. Sure. Okay, good. Aren't we all? That's why we're here. Try to prevent that from happening. Try to help. Okay, so today I'm going to talk about the symptoms, signs and symptoms of more of those clinical disorders that are classified under depression and anxiety. And we're going to go into treatment options because these are treatable conditions. We're going to talk about treatments, what's out there that can help. And then we're going to get into some different behaviors or lifestyle changes that you all can participate in to help take care of your own mental health. All right, so some key facts. Depression is not a normal part of aging, but it can be common in older adults. Depression, again, I've already said this a little bit, but it's not just feeling sad. It is a treatable condition with a variety of symptoms, and everyone's presentation of it can be different. And the key thing is it impacts our ability to function in daily life, to complete tasks, to participate in things that are typically pleasurable to us, to engage in a healthy way in our relationships, those kind of things. Depression in older adults is often undertreated. Older people compared to younger people are less likely to seek help. There's some good data behind that. Less likely to seek help for mental health challenges. Some key facts about anxiety. Anxiety is a common and normal response to stressors in everyday life, but it's when it starts to impact your well-being, your ability to function on a daily basis, that it can become more of a condition that's considered a treatable illness. Clinical anxiety disorders affect nearly 4% of older adults across the world. And I already kind of said this one, that older adults are less likely to seek help. So some data for us. There's approximately 56 million Americans over the age of 65. So to just think about how many of us are in that population. and approximately 1 to 3% of older adults are living with depression, clinical depression. And this number is higher in folks that need home health care or that need a lot of support to complete their activities of daily living. Higher in people with multiple chronic conditions. Those are risk factors for depression. It's also likely that these numbers are a lower estimate than actual because people so often don't recognize that's what they're experiencing or they're not seeking help. So this is probably an underestimate of the actual data and amount of people that are affected by this condition. Older adults 65 and plus accounted for 18% of suicide deaths in 2017. So this is a pretty high number. Something to be looking out for and to talk about. Between 3 and 14%, so that's a pretty broad range, of older adults meet the criteria for a diagnosable anxiety disorder. And a recent study that came out in 2023 found that adults 18 and older, over 30% of adults 18 and older identify as having symptoms of depression and anxiety, over 30%. So things have gotten a little bit sticky in the world. There's also a lot more awareness and openness about this, so that can make those figures go up too. Okay, so this is a typical question that is asked, a screening tool. You all might be familiar with this. A lot of times it's part of routine screenings in primary care, but this is a PHQ-2. And I would love for you to just kind of quickly consider this for yourself. Over the past 2 weeks, how often have you been bothered by any of the following problems? Little interest or pleasure in doing things, not at all, several days, more than half the days, nearly every day, and feeling down, depressed, or hopeless. And that same scale. So just kind of consider that for yourself. I'll give you a minute. Okay, so a score of 3 or more could indicate signs of a depression and would, if you're in the, getting this formally in a medical setting or mental health setting, would prompt a more in-depth interview with a provider to understand what's going on. But this is kind of the first initial screening tool that's used. And just hopefully that was interesting to you all, eye-opening perhaps. Please be aware of what you saw when you filled that out and assessed yourself. Okay, oops. So some symptoms of depression, and what I'm again talking about is the clinical depressive disorder. One of the main symptoms is loss of pleasure in things that you used to enjoy. Sadness, feeling low, feeling hopeless, changes in weight or appetite, changes in your eating habits, sleep, changes in sleep, fatigue, less energy than usual, restlessness, lower ability to concentrate and make decisions, low self-esteem, preoccupation with thoughts of suicide or harming yourself. I want everyone to be aware of this box on the screen that there is now a national hotline, a 3-digit number for our suicide crisis helpline. So you would dial 988 if you are feeling like you are in immediate danger and you want to harm yourself, dial 988. So that was a really helpful change recently that the federal government made to make it easier to reach out for help in those moments. Pass it along. Please call if you ever need it. But these are the symptoms of depression. The first two, one of those two have to be included, and the rest, I believe it's 5 or more in the last 2-week period. You need to be experiencing a lot of these over the same 2-week period, and that's how that's diagnosed formally. The thing to note is depression looks different in all people individually, but in older populations, there might be less clear emotional symptoms and more common physical symptoms. So maybe dull pain, muscle aches, appetite loss or sleeplessness. Also, memory challenges, lack of concentration, that can be a much more common symptom in older populations. So it can be kind of confusing to know what's going on. Is this a medication side effect? Is this cognitive impairment? What's happening here? And I'm going to quickly show us the difference between depression and dementia in just a moment. But just be aware of some of the unique presentations of depression in older populations. They tend to be different than in younger. So this kind of helps, or it's a challenge, because it might not be recognized as obviously, because maybe sadness isn't the most prominent symptom. And also patients might not realize that they're experiencing depression. So just to outline the differences, with depression, it's more of a rapid decline, mental decline. People with depression are oriented to time, place, date. You might have difficulty concentrating, whereas dementia typically has more of a short-term memory challenge as a primary symptom. Language and motor skills, so your ability to speak and communicate, word find, is maybe a little bit slowed, but it's not as dramatically impacted as it can be by dementia. Also, you will have awareness about your memory problems and lack of concentration, whereas some people with dementia are not really realizing that they're having those challenges. So that's one of the key differences, is you're realizing, oh, I'm kind of forgetful lately, or having a hard time concentrating, and it might be more in your awareness and your ability to recognize that within yourself. Okay, so there's a lot of different causes of this. Genetics. Some people it might run in their family. There's a lot of different medical problems, heart disease, chronic conditions that can increase our risk of depression. Symptoms of cognitive impairment. So to get it a little bit sticky and confusing again, depression can be a symptom of cognitive impairment or types of dementia. Medication side effects, and just challenging life events. A pandemic. Loss of a spouse, a new health diagnosis. These are common stressors that can impact our mental health. It's typically a combination of factors. So just be aware of that. It's typically not one thing that can lead to it, a combination of factors. So are there any questions before I move on to talk, any questions about depression? Okay. I know this is a lot of information. I did mean to comment that depression is in the category of mood disorders. So there's some other technical illnesses that lead to feelings of depression. Bipolar 1 and 2, seasonal affective disorder is an actual diagnosable illness that people are noticeably feel worse during different times of year, seasonally. So just there's some different categories that have symptoms of depression, but they are a unique mental health condition. Yes? What I define stress as it relates to depression. Yeah, stress is a really commonly used term. It's when our body has a strong reaction to something that is difficult. It causes release of cortisol and different hormones in our bodies. So if we're feeling down, there's like a lot of resistance against the world. So it can cause us to feel stress. Things that might have been harder, might have been easier, are feeling harder now. So we're feeling more stress than maybe we would have. I think that's a tough one to answer, but hopefully I did it a little bit of justice with that response. We are going to talk about stress more and how to manage stress and how that can help us feel a little bit better. A lot of the work that I do with my clients is to help calm people down, manage stress, recognize your triggers, recognize how you're feeling physically, because that can really help you to calm down, take control. Is it thoughts that are making you feel bad? Is it situational things that are making you feel bad, more stressed, more agitated, worked up, worried? So being aware of the physical response that things can have is really important. Thank you. So we're going to talk about anxiety. Anxiety is a separate classification of mental health challenge. It's a normal response to life stressors. It can even be helpful in certain situations. It can help us avoid danger or deal with challenging things. But it's when it begins to impact daily life tasks, impact relationships, it's when you're feeling overwhelmed, you're feeling like you can't control the worry, that's when it can maybe move into more of an illness. So there's different types of anxiety. The most common type of anxiety is generalized anxiety disorder. And this is chronic worry. Oftentimes it's worry that's maybe a little bit exaggerated. So the actual issue at hand, you're feeling an exaggerated response to what that issue is. It affects everyday life, affects routine events and situations. And for this to be diagnosed, you have to be experiencing this feeling and this state for at least 6 months. Okay? A lot of times anxiety also brings about physical symptoms. Racing heart, muscle tension, headaches, that's a common response to anxiety. There's some other disorders that fall under the anxiety category. Panic disorder, where you get physical panic attacks, and then you worry about getting further panic attacks. That's the common cycle with panic disorder. Obsessive compulsive disorder, where you have recurrent unwanted thoughts, which are obsessions, or rituals, which is the compulsion. So some people wash their hands compulsively, or clean their house compulsively, or have to check their email compulsively. So those are things that you feel like when you can't control something, you do these obsessions and compulsions to help you control a situation because you're feeling anxious about it. Post-traumatic stress disorder, PTSD, is also under the anxiety umbrella. This is persistent symptoms that occur after experiencing a trauma, can be negative thoughts about self, intrusive dreams or memories about an event, and there's also physical symptoms to PTSD, and a phobia. Phobia is a really concentrated, extreme, often disabling fear of something that really doesn't pose actual danger. So a specific phobia, heights or spiders, really specific kind of things that people might have a phobia around. So these are different types of anxiety disorders that are in our diagnostic Bible. The DSM is where these things are all included and differentiated between each other, used for insurance, used to help understand what someone's experiencing, and to have a little bit of uniformity with these types of mental health challenges. So some symptoms of anxiety, as we all are thinking and know, worry, excessive worry. And it's when it gets hard to control more days than not. Again, there's normal anxiety, there's normal nervousness when you're trying something new or when you're speaking to a room full of people. But it's when you can't control it, when it's happening all the time, more days than not, okay? When we're feeling restless or on edge, easily fatigued. This one also impacts our ability to focus. Maybe we're a little more irritable or quick-tempered than we typically are. A lot of times there's physical symptoms, maybe headaches, unexplained aches and pains, difficulty controlling feelings of worry. Sleep problems can also be really common with anxiety challenges. These are the symptoms of anxiety. And for these, they need to have, let's see how many. It's 3 or more of these symptoms over the last 6-month period. Okay. So again, like depression, there's a lot of causes. Stressful life events. Maybe it's a car accident or loss of a spouse or the COVID-19 pandemic. Loss of independence, challenges with physical mobility, sleep disturbances. When we have a bad night's sleep, how does everyone feel the next day? Yeah, you're feeling kind of anxious, you're feeling on edge. So if that happens chronically, it can lead to anxiety. It can lead to more of a chronic symptoms of anxiety. Chronic health conditions such as diabetes increase our risk for anxiety challenges. And family history, if you had kind of genetically predisposed to having that within your personality, within your reactions to life, consider that. Some medications can increase symptoms of anxiety, like steroids or stimulants. Misuse of alcohol or other substances. A lot of times people with substance use challenges have anxiety challenges or have depression challenges. Many of these things occur together. Certain cognitive diseases, neurodegenerative diseases, can also have symptoms of anxiety. And a really important one to note is adverse childhood experiences. There's been a lot of studies around what, excuse me, I'm going to grab a sip of water. There's been a lot of studies that have come out around ACEs, adverse childhood experiences, and how when we're little, we experience traumatic or disturbing things in our household, that can lead to much greater risk for physical and mental health issues across our life. So it's a really common thing that we've all encountered as kids, and it can lead us to increase our risk for anxiety and depression later in life. I believe the number, I think 6 out of 10 adults that were surveyed had at least one adverse childhood experience in their childhood. Substance use in the home, physical abuse, neglect, these kind of things that occur when we're young, impact us across our lifetime. Okay, so we talked about anxiety. Any questions about that? Okay, so I want all of you to just check in with yourself for a minute. This is really intense talk, subject matter. Might bring up some, feelings within yourself, or maybe worry about a person that you love that's experiencing this stuff. So I'm going to talk about treatments in a second, but I just want everyone to check in with themselves. How are you feeling about this? Is this stirring anything up within you? Take a deep breath if it is. Okay. All right, good. So now to more hope and options about what can help us. Again, I've really tried to clarify the difference between, what constitutes an actual mental health illness or disorder, what those criteria are. And with that, that means there's treatments that can help. So I'm going to talk about psychotherapy or counseling or talk therapy, medication, and healthy lifestyle changes. These are things that controlled research studies have found to make a difference, to help reduce or eliminate symptoms, lower the risk for suicide and early mortality, improve our physical health, and reduce disability and how these different things impact our daily life, our ability to function. We got some sunlight, some rays of hope, rays of options coming through the trees there for you. Okay, so obviously this one is near and dear to my heart. This is what I do as a professional. I'm a mental health counselor. So what psychotherapy does, and there's kind of a lot of interchangeable terms for psychotherapy, counseling, talk therapy. In the US, often these are really interchangeable terms depending on who you ask. But what happens with this is it's a trained, at least master's level professional. There's licensed clinical social workers, licensed mental health counselors, marriage and family therapists, psychologists are the professionals that typically do psychotherapy. Some psychiatrists will do psychotherapy, but they're often more focused on medication management, symptom management through those types of interventions. But basically what happens is you meet in a safe environment with a trained professional that offers techniques to help identify unwanted thoughts and behaviors, things that are not helping you live your best life. Have a safe place to actually express, acknowledge, and admit how you're feeling about things. So often we don't really talk about how we're feeling. or we push our feelings down because it's easier to we think it's easier to avoid feeling them. So actually just naming and stating and feeling what's really going on with us internally can provide so much relief, just that. So this is a place to do that. It's a place to help work on ways to manage the challenging parts of life. Is it adjusting to a new diagnosis, or to deal with grief? Or you've just moved to North Florida from a different part of the country and you're having a hard time. Challenging relationships with your children. These are the types of things that you can work on. It doesn't necessarily have to be about problems, and I know I talked a lot about the clinical stuff, but I don't really even talk that much about diagnosis and all of that in my sessions. I just try to get to know people and help them be their best selves. It's a lot about their relationship with a counselor that can make a huge difference. So you might not have the right person initially, and that's okay. To be like, yeah, I didn't really mesh with them. I don't think they understood me. I didn't feel comfortable. Find somebody else. Not everyone is a good fit for you. There's counseling often takes place individually. It can be done as a couples counseling, family counseling, or there's group interventions where you're with a group of people working on mental health challenges. Some different examples. Every therapist or counselor has their own unique approach, but there's some different examples. One of the most widely well-researched, well-founded types is cognitive behavioral therapy, which is really centered around reality checking your thoughts. Is this actually true? What is this doing for me? It helps you identify, understand, and modify your thinking, and also set goals for behavior change. And those two end up influencing each other. Our thoughts influence our behaviors influence our thoughts. So that's really what CBT, cognitive behavioral therapy, focuses on. Interpersonal therapy focuses more on helping people in difficult relationships with others. Acceptance and commitment therapy is a newer type of intervention. Well-researched, really great results of this type of intervention, but it focuses more on embracing all of the things that come up, finding more acceptance for our symptoms, for our thinking, for our emotions, being a little bit more flexible and self-compassionate with ourselves and how we're feeling about things, and really learning how to be present in the moment, how to be mindful, how to not live in your thoughts and your fears about the future, but how to catch yourself and be able to observe that and make changes in the present that align with who you are and what you want out of life. So that's a lot of what ACT, or acceptance and commitment therapy, focuses on. So there's a lot of different types of interventions, but I just wanted to highlight a few. So medication is another evidence-based treatment option for depression and anxiety. Antidepressants are often prescribed for depression. I will say that I am not an MD, I'm not a prescriber, so this is not really something I can get into too much, but basically just states, kind of explain what some of the common medications are. Antidepressants are one of the most common meds for depression. SSRIs, selective serotonin reuptake inhibitors, is the most common type of antidepressant, okay? And those help the absorption of serotonin, so we have more serotonin. That's a chemical messenger in our body, has a huge function in our body, impacts our mood, amongst many other things. So antidepressants can take a long time to work. That's something to be aware of that a lot of people struggle with, is they start a new med and they're really looking for some relief, and I don't blame you. But it might take a month or so for it to really kick in and get integrated into your neural processes to make the difference. So give it some time, be patient, be aware of how you're feeling after you start a new med, and definitely talk to your provider about any symptoms you're having that aren't feeling good. If it's not working, maybe there's a dose change or a different type that might be better for you. But please don't stop taking your medications without working with your provider, working with a pharmacist to safely do that. Medications for anxiety might include benzodiazepines. Antidepressants are often also used for anxiety treatment. And beta blockers are sometimes prescribed because they impact more of the physical symptoms of anxiety. So those are some of the meds that are often prescribed. Typically, the most effective approach is a combination of medication and psychotherapy. Okay, so I want to make sure that people are aware. How do I find, you're ready for counseling, you heard my talk, you're like, hey, this is the right thing for me to do and explore. How do I find someone? So this is a service through the Big Bend Mental Health Council, where they have a search tool online. You can search providers in our region, in person or online. Are they accepting new patients? Do they take Medicare? Do they specialize in OCD? Do they specialize in trauma? Do they specialize in grief? You can kind of search by all those different filters. It's a really awesome tool. So please be aware of that. It's a partnership between Appalachia TMH 211 and FSU College of Medicine. And I did have a link to that on the handout that was passed out that hopefully everybody received. There's a couple more copies on the table over there if you did not receive it. It has links on the bottom of the page, so you have that for your records. But please be aware of this option for yourself. Okay. So to quickly just highlight some of the things that you can do and be aware of if you're trying to help somebody else that's struggling with a mental health condition. Offer support, be patient, try to be non-judgmental, listen. Listening is key, being a good listener. Try to refrain from giving advice. I know that's hard because we have great intentions. And you know something that's helped you, but that doesn't mean it's going to be helpful for another person. And sometimes you can ask, would you like me to just listen? Would you like advice? Oh, ask someone what they're looking for. And maybe they really just need to vent and they need to be understood in the moment. So that's one of my main takeaways for this is just be a good listener. Try to invite people to engage socially. Meet them where they are, even if it's 10 minutes, if it's a short walk, if it's a hug in the hallway, whatever it might be, try to stay connected, try to be there for that person. Shoot them a text message. I'm here for you if you ever need to talk. No pressure, but just letting people know that you care, letting people know that you're available to be a support for them. Okay. If it's a close person to you and you are more of a care partner for them, help them stay on their medication regimen, help them do the things that their providers are recommending for good outcomes. Okay. So what can we do? Some tips for lifestyle changes, being aware, and this is really helpful, these things for any of us, whether we have more of a severe form of mental illness or we just sometimes feel a little bit stressed or anxious or worried or down. These are things that can help. So learning how to cope with stress. One way we can do that is to manage our thoughts and our beliefs. Our minds can do a really good job of convincing us of things that are not quite true. Some people's primary symptom is self-criticism, self-judgment. We think that's going to help us make improvements in the future, but it really doesn't. What actually happens is our body kind of takes that as just another threat or attack to itself. So I encourage people to really notice your negative self-talk. What are you saying to yourself on a regular basis? And try to change that. Try to change it to something that's a little bit more uplifting. Instead of, oh, I can't do this, it's too hard, change it to, I've overcome hard things in the past. Try to find that confidence, that spark within yourself, that reminder of when you have overcome challenges, when you have dealt with hardships, because I'm sure all of you have at some point. So recognize your ability to be resilient and try to bring that out for yourself in the moment. Another thing that is sometimes helpful is to just notice, oh, I'm having a thought. I'm having the thought that I'm not a good mom. And it's like, oh, that's just a thought. That's not the reality. So we can it almost makes us feel like it's more in the distance instead of an actual true statement about ourselves. So just I'm having the thought that, adding that in front, distancing yourself from the thought. Another area is mind-body relaxation techniques. These things send messages to our brain to relax, that we are okay, that even though our thoughts might make us feel like we're unsafe or there's a threat, that we are actually safe, we are in control. So this can be done through breathing exercises, or maybe we do a body scan where you just simply notice your body, how you're feeling physically, start from your feet, your ankles. It's all about non-judgmental awareness of your physical self. Noticing your hands, just kind of paying attention to your body, because that helps us calm down. It sends a message to our minds that we are okay. So humor me here. Let's try one together. I know I'm kind of running out of time, but we're almost done. This is called box breathing. It's a easy to remember and utilize breathing technique, and it just helps us slow down our breathing and focus our attention on our breath, which activates the parasympathetic relaxation part of our nervous system. So what you want to do is picture a box, and you can just do this with your imagination. It's helpful to have a little diagram, but just picture a box. I personally find when I'm doing breathing exercises that closing my eyes does help me bring my focus inward and focus on the physical sensations a little more instead of being distracted by what's around me. But you don't have to close your eyes, but if you want to, gently close your eyes if you feel comfortable with that. Picture a square in front of you. And I want you to really focus on breathing. Focus on an inhale, counting to 4 across the top of the box on an inhale. Holding your breath across the side of the box and exhaling across the bottom of the box to a count of 4. Holding across the top left-hand side of the box and inhaling across the top to a count of 4. Holding across the side of the box and exhaling, letting it go across the bottom of the box. Holding across the side, moving up the square, and coming back to your normal breathing patterns. And just notice how you're feeling after you do that. I feel like the room's a little calmer. You all feel a little different after that? It's a great technique to try when you're feeling nervous or worked up or just need to check in with yourself, give yourself a little relaxation break. The good thing about breathing techniques is no one really knows you're doing it. I mean, maybe if you close your eyes, but you could just focus on taking deep breaths and give yourself that little break for a second. Regain control of your body's sensations through your breathing. We have our breath with us all the time. It means we're alive, so let's use it to help us calm down a little bit. Thank you for doing that with me. Great job. Give it a try. So I'm not going to really get into this one because we have some great speakers that are coming after me that are going to get much more into the details of these types of activities. But meet your basic needs. Move your body, take care of your physical health, eat well, exercise, and get quality sleep. Try to do these things as much as you can. Set little goals to help you meet those activities at a realistic level for yourself. Okay, think about realistic goal setting. What can you achieve? Because you want to do things that you are able to follow through with so you actually feel more confident in yourself and feel the positive benefits of it. So exercise, nutrition, and sleep can really help improve our mood. And lastly, my last tip is to be social. Be around good people. When we have social support, we feel connected, we feel empowered, we feel less alone. Having social support can help buffer some of the distress that comes from mental health challenges. It can give us that outlet. It can help us feel like we matter. And it can be a good distraction to take our focus off of our own problems and help someone else enjoy their company. So I want to just give a quick plug. The Tallahassee Senior Center has a program called Upslide. I'm a counselor with Upslide, and we are focused on mental health, on social engagement. We have a Friends Connection group. We have counseling. We help connect people to things that are meaningful to them. So that's here for you in Tallahassee. Be social. You all are already doing that by participating and joining your peers, being with your neighbors at this event, so keep it up. So those are my 3 tips that we can do, and that is the conclusion of my portion. We're gonna have questions at the very end, so please make a little note if there's a question that you wanna ask, and I'll be sure to try my best to answer it at the end. But thank you all so much for your attention and just caring about this issue. It's very important.
Thank you so much, Nicolette. Now, Don, it's your turn.
Hey everybody, how's it going? I don't have any slides, so you'll just have to pay attention to me. But Nicolette had some really great points about everything she was talking about as far as things that you can do to help improve your mood, help decrease anxiety and deal with some of the depression or anything that may be going on. And so I just wanted to share a few different things and then give you some ways that you can, put some actions into play and start making a plan for yourself. So, you guys, you may have experienced, and some of you already do this, getting outside, like going on a walk, going to ride your bike and doing your exercise. You may notice that you feel a little bit happier and a little bit better after doing those things. And there was a meta-analysis study that was done. So that means they looked at 33 different studies and they compared them all, and it was focused on it was in the context of weight training, and some people did weight training and some people didn't. It was between 2,000 men and women of all different ages, and they were tested for depression before, during, and after the trials. And the thing that is most important to kind of take away from this is that the people who were depressed before the study showed signs of improvement. People who didn't seem to have any signs of depression, it seemed to help delay any or negate anything coming that may have happened in the future. But really the most important thing, and the point that I wanted to get across, is that a lot of people want to know, okay, like what exercises do I need to be doing? Like what's the workout and the stuff that I should be doing? And the number of workouts, the repetitions, the amount of muscle that people gained, and the strength gains that they made no difference. It was simply the fact that they completed the exercise. So that's a really big thing to focus on. It didn't matter how long it was, what you did, and that's just playing back into the part of find something that works for you. So whether somebody can have a completely different routine from yours. Maybe somebody goes to their classes 3 times a week and they go and they ride their bike and they do all this stuff. Maybe yours is that you're coming to the yoga classes and then you're doing stuff in the pool. And so the biggest thing is that you're giving yourself that confidence that you're completing the task, but also some of the other points that she touched on, just maybe having the anxiety of if you have, different mobility issues of getting around, of being able to go for a walk. I know a lot of us too, it's like we're going on our walks and now, we see curbs and we see different obstacles and stuff that may give us a little bit of anxiety or not make us as confident in our abilities to get around. So being able to work on those things and empowering yourself and completing a workout and just kind of checking that box is going to be a really big thing to focus on. And also a lot of the other things, getting outside that she touched on is another great point. So getting outside and getting fresh sunlight, doing this with friends, making it a social aspect is a really big thing. And if you're somebody who is currently involved in the fitness programs, you know that whether it's coming to the core and balance classes or it's coming to the pool classes or the men's club classes, or if you go to the Zumba, it's all a kind of a core group of the same people, and you're waiting to go there and to see your friends and to have a good time, and you're going to laugh and smile, and that's also a really, really big part of it. So just doing something that you know that you're going to enjoy, you're going to look forward to going to it, you're going to see friends that you know, all those things play a really important factor in getting some of these improvements. So don't get too worked up on trying to do the absolute like perfect thing for your exercise. It's really just creating a plan and doing something that'll work for you. There are little bits of things that can go into it too. So they're doing different types of exercise, whether it's going to be strength building or cardio, are going to be really beneficial, and you really should be, trying to focus on both of them as much as you can. So getting a little bit a mixture of something that's maybe getting your heart rate up a little bit, but they found that with some of the studies, especially when it's dealing with trying to reduce the levels of anxiety, that maybe doing really high intensity short break exercises may not be the best thing for you to do. So taking it, lowering the intensity down to more something that's a little bit more moderate, taking a second and breathing and resting between your sets and doing exercise like that, it may be a more beneficial route towards you. So that's why it's good. I encourage all of you after this who aren't already involved in anything with fitness, so we can come down and create a plan that's specific to you. So we can come down, whether it's, finding out what classes work, doing some one-on-one stuff, giving you a routine, and finding, hey, what is my exercise program? And like she said before, also it's what works for you is not going to work for somebody else. So even though somebody else, and you're like, hey, I heard so-and-so did this, but I don't really like doing that. Like, don't force yourself to do something that's not going to be inviting and enjoyable for you. So that's another good thing to keep in mind. So meditation is also, again, some great thing that she touched on. It's going to be focusing on that breathing, and meditation is a really good thing to just be kind of aware of how your body is feeling throughout the day, and just kind of being in touch and in tune with your body and what's going on, because things are going to be changing. A lot of us, in the past, we may have been, really amazing athletes. Maybe you used to like run triathlons, you used to swim, you used to dance, you used to do all of these things, and focusing on finding what works for you and your body is going to be the best thing, but allowing your mind to kind of calm down and relax and kind of be in tune with your feelings is a really important part. And there's an exercise that I heard before, so kind of like how she has close our eyes and do our breathing a little bit, and saying how you have these thoughts that may come about, and not trying to associate yourself with those thoughts is something that's really, really important. So if I were to tell you right now to just envision in your mind and think of a red triangle, you can close your eyes or not, and you can think, all right, red triangle. Now I want you to think a blue square. Think of a blue square. All right. Now, if your eyes are closed, you can open them back up. Do any of you think you are a blue square or a red triangle? No. That was just a thought that you had. So it's a little bit of a dramatic thing, but again, it's just playing back on you are not your thoughts. So when you have these thoughts or ideas or things that may come into your head that may be getting you down, just realize that that thought's coming into your mind. You can observe it. You can let it pass. So the breathing, the meditation, focusing on your strength training, focusing on different kinds of cardio to help build your heart health and things like that, getting outside, making new friends, having that social aspect. These are all things that are going to kind of encompass your fitness and your well-being, and things that we can help you with down in the fitness center. So again, I encourage everybody to please come down, talk to us. Let's create a plan. Let's find something that works for you. Also, if you're coming, bring a friend. If you already come to classes and there's ones that you like, bring a friend with you if you think that they'd enjoy it. And I just want everybody here to be, I want fitness to be something that you look forward to, and something that you really enjoy doing, and you can still make really great strides and great changes in your health and your well-being and your fitness at this time in your life. So is there any questions or any general questions anybody had for me about anything relating to your fitness or your exercise or anything like that?
Are you making appointments now?
Yes, we are making appointments. You can either email me or you can dial extension 293. That'll get you down to the phone at the fitness center. Even if we don't answer, just leave your name and leave a message, and we can make an appointment to come in, whether it's to do an assessment, just to sit down and talk with you to go over how everything works, to do some one-on-one stuff. But yes, you can email, you can call down, or you can just come down there, and we'll definitely make an appointment and see what we can get going for you, for sure. All right, that's all I had. Thank you very much, everybody.
Thank you so much, Don. Peggy?
Well, good afternoon. Oh, okay. Good afternoon. I just try to fill the small gap from our two speakers. Let's just talk about nutrition and the diet for mental health, and focusing on depression and disorder, anxiety disorder. Well, my presentation includes two parts. The first part, I will show you just how nutrition play a role in managing depression and anxiety symptoms. And also, I'll make some dietary recommendations accordingly. The second part, and let's just look at some ways to improve the appetite and ensure safe eating for senior individuals with depression and anxiety. All these slides here, I have made this handout, 4 pages stapled together. So you can, after the meeting, you can get this from there, so you don't have to take notes or not familiar with my accent. So, so that's one set, 4 pages of this presentation slides. Well, let's look at just last Monday, okay, CNA reported this. The French fry actually negatively impact linked to depression, okay? This is April 24th. In fact, research has been showing that if you frequently consume those fried food, and not just the French fry, that's linked in higher risk of depression and anxiety. So food may play a bigger role than you may think. Let's just look at some evidence. The first one, certain nutrients like omega-3 fatty acid, vitamins B and D, they have been shown to regulate mood and reduce the symptoms of those mental health problems. Low levels of these nutrients, they have been associated with depression. Those are just the scientific data shows that. The second one, blood sugar. Imbalanced blood sugar can contribute to mood swings and anxiety. So eating a balanced diet can balance your blood sugar and provide enough vitamins and minerals to support your mental health. Following is inflammation. Inflammation is associated with depression, also is, depression and anxiety. And certain food, such as fruits and vegetables, seeds, or nuts, they contain rich in inflammatory or antioxidant chemicals that can help you to reduce the inflammation in the body and improve the your mood. The last one, that's the gut health. Strong evidence show a healthy gut, actually, the healthy gut microbiome. That means a collection of those bacteria and microorganisms in your gut. Well, they link to improve the mental health. If you're eating a diet rich in prebiotics and probiotics, that means prebiotics, that's kind of a fiber, those bacteria, good bacteria's food, they help support our gut health. So based on the above, I'm making several dietary recommendations here. They are very important for both physical and mental health. The first one, I think we can quickly just go through this one. From the handout, you can read each good source of each category. The first one, of course, we have to eat a balanced health diet. And that includes each category, and I will provide more information about what diet will be balanced, healthy diet. Second, increase the intake of the omega-3 fatty acid. Omega-3 fatty acid provided by fatty fish, we talked about last time, and the plant source of the omega-3 fatty acid are also available. However, the fatty fish probably responsible for most of the good effect to improve our cognitive function. The next one, we just mentioned the vitamins and minerals. A balanced diet also provides adequate vitamins and minerals, especially vitamin Bs, including B12, B6, and folic acid, and vitamin D. They all prove they important for our brain function. Good sources like dark leaf vegetables. This is in the whole grain. I listed over there for your reference. The next one. I forgot to wear my glasses. The dietary, the next one, just we mentioned, include some prebiotics and probiotics in your diet. And like yogurt or kefir, that's supply good bacteria from there. Actually, kefir is better than yogurt, and the Greek yogurt is even better than the regular yogurt. Prebiotics rich like food like onion, garlic, and the seed, and leek. And but I wanted to mention this here. Regular laxative, if you regularly use that, that may negatively change your gut biomicron. So just be aware of that, because the seniors maybe this is one of the concern to resolve this constipation problem. Next one, the dietary protein. I wanted to spend a few minutes on this protein dietary intake for senior. Everybody requires different ones because the age, gender, weight, and activity levels are all different. However, in general, I recommend the general recommendation for senior citizens, the protein intake should be from 1 to 1.2 grams per kilogram of your body weight. For example, if your body weight is 60 kilograms, which is 150 pounds, okay, then you need to make sure you take about 60 to 72 grams of protein every day. Okay. Well, I'm not talking about the protein powders you can weigh. To take enough protein, good quality of protein, has to be consumed as a balanced diet. So consume those good protein from those protein-rich foods. It's very important for senior to consume enough protein to help maintain your muscle mass, your support our immune function, and promote overall health, including mental health. I also include a handout over there. That's 2 pages titled Protein Content of Common Food for your convenient use to estimate your daily protein intake from your meal. Because this is quite important in case you just need you have some questions to how to figure out how much protein, if you consume enough protein or not. I would be very happy, to help you individually. I'm a resident here, so I'm available every day. The next one, of course, stay hydrated, drinking enough water. The dehydration definitely causes some kind of fatigue and irritability that contribute to the mood swing. The next one, as our speaker just mentioned, we try to avoid or limit the processed food and the added sugar, because those may cause your blood sugar imbalance, and we know that definitely may cause some body inflammation problem and affect the mental health. Well, the next one, I would like to introduce to you 3 closely related healthy diet as a general guideline for your use. Recent studies found that Mediterranean diet and the related so-called MIND diet and the other healthy eating pattern have been associated with cognitive benefit in studies, including Alzheimer's disease, dementia, and the mental health. The Mediterranean diet, just the emphasis, fruits, vegetables, whole grain, legume, fish, and other seafoods. Unsaturated fat, we call this a good fat, such as olive oil, and the low amounts, or just try to avoid red meat, eggs even, and sweets. That's what all about Mediterranean diet. Okay, what is the MIND diet? MIND stands for the Mediterranean dash. That's the combination of these 2 diets. Intervention for neurodegenerative delay, which including Alzheimer's disease, dementia, things. So it combines the MIND diet, actually a variation of Mediterranean diet. It combines this Mediterranean diet and the DASH diet to create a diet aimed to reduce the risk of decline in brain health that we seniors often experience. So this is the diagram of dietary, DASH diet. That's the acronym for dietary approaches to stop hypertension. So very similar to the Mediterranean diet, but it gives a very clear recommendation for the servings from each food group. So last time we talked about the heart health. I have already provided this handout, and today this is an individual handout on the table for your convenient use, because this illustrates that very clearly. The next one, I wanted to give you some guidelines for how to use the MIND diet. So those are ingredients. I think you don't have to take a picture because I have this the print out for you. From each group, the MIND diet focuses on 10 groups of those favored food groups, just like vegetable, berry, whatever. Okay, that's over there. I just cannot speak very fast, so list this clearly for you to look at. It just also provide the numbers of servings per week, as a guidance, so you can choose those food from those 10 good group and decide what you want to include in your daily meal. But this also focuses on 5 groups. That's red meat, sweet, cheese, butter, or margarine. That's solid fat, and those fried food. Try to limit them or avoid that. And I also provide some calories needed for men and women every day. If you are inactive physically or active physically, you need a different amount of calories. However, I just want to emphasize the protein requirement. You need 1 to 1.2 grams of protein per kilogram every day. That's regardless of how much calories you take. If you take a low calorie, you still need to have adequate protein supply from your daily meal. Well, just quickly go, move to the second part. Well, because almost all of the mental health disorders were linked to nutritional deficiency. Because people with depression or anxiety, they commonly have a poor appetite. They skip meals and crave sweets. Therefore, how to help them to improve appetite and eat a balanced diet also is very important. I include, just point out several things that we may do. The first one, color, food color. If we incorporate some bright and vibrant color into your food presentation, can help make meals more visually appealing and enjoyable, which of course in turn stimulate the appetite. Similarly, the color of the plate or tablecloth can also affect your appetite. By looking at those pictures, even before we actually taste those, but they look appealing to us, right? Therefore, I think I make a small suggestion. If you take out meal from the dining room, okay, you bring back to your room and start to eat. Well, why not just transfer your food from the plastic container to a nice plate? And sit well, maybe turn on some music, make this whole environment more pleasant for yourself, and you feel like the food tastes better, and you feel happier as well. But this is my personal experience. When I just take the food directly eat from the plastic container, I just lost all my appetite. Okay, little bit about the texture. Well, of course, I think as we age, our digestive system function just a kind of a decrease, and we have some kind of difficulty to chew or break the food in the mouth. Therefore, sorry. Choose some easy to chew or swallow food or with the soft texture, not only help with your digestion, but also ensure the good nutrient absorption. And also, we may lose our, appetite, but somebody serve some food with interesting texture, then you change the texture or the mouthfeel, that may improve your appetite. And also because, chewing and swallowing may be a problem, then this has the risk to cause the choking or aspiration. Therefore, we need to consider the appropriate texture to serve or to eat by yourself. That ensure the safe eating. The next one, I think the last one, I don't know why. Okay. The next one. Okay, this is the last slide. I think the environment also very important to help to improve our appetite. Use soft and warm lighting, and play some soothing and calm music, not those kind of rock and roll, the too loud music that make you very nervous. And also turn the temperature, control this very comfortably, and also eating in a clean and nice environment. This is all very important. If you decorate, the table or the environment, I think this is even better. And also, if you have a company and engage in some very pleasant and a positive conversation, that definitely will encourage, the person to improve their appetite. I think I just briefly to go over this those points, and please just get those handout from the table. If you have any specific questions, I would be very happy to answer after this or anytime. Okay, thank you very much for your.
Thank you so much, Peggy. He has a question, but I'm.
My question is, because usually, let me explain it very simply. Usually I go to the Walmart to buy the banana. But at the same time, also we go to the Trader Joe to buy the organic banana. So could you please explain to me, is there any difference between organic or non-organic? Not including banana as an example. For instance, meat, vegetables, various kinds of things. Everybody follows to the organic.
Yeah.
But sometimes we go to the Walmart. I mean,
Thank you.
how about
Let me repeat your question. I know people need to leave, and we've gone a long time. The question was, what's the difference between organic and not organic? And Peggy, can you just say something briefly?
Well, I would highly recommend use organic, especially organic meat, okay, as much as possible. Because in the United States, actually 75% of the meat, pork, beef, and turkey, they use some chemicals, in the feed. Those chemicals have been banned almost all over the world, but United States still allow that without labeling. Therefore, I think eat meat. You want it to be healthy, I highly recommend to choose organic or grass-fed beef, that kind of food. Yeah, this is good for your health. If you are a meat eater, you eat every day the larger quantity, I think it matters. And for the fruits, I think if, not all the organic fruits or vegetables are available, but use this as much as possible. Because they
I want to give a thanks to all our participants, and anybody with questions, please linger. I'm going to make an executive decision. to end the program now. If any of you want to hear a conversation with Linda and me, you can come up afterwards, we can have it. But I think it's time to thank you for being here.